do much MR thermometry. So okay, from the previous slides, we have shown some or more examples of the clinical treatments, and I would like to show you some potentially future directions, and for example, how to deal with motion. So these slides show, for example, the displacement of the organs in the thorax and abdomen. Let's say, for example, the liver and heart, and you have different sorts of motions. For example, the breathing, what you can see from the liver going up and down. The heart is a combination of the breathing activity and the cardiac contraction, but you have also the motion of the blood inside the arteries and vessels. One method to compensate for motion would be to use triggering or gating, but this is very slow, and this is in fact not very practical for monitoring in real time the MRI. So the other option is to use very fast acquisition, much faster than the typical duration of this biological phenomenon, and then to use motion compensation techniques. So how can we do that? For example, you can, for the respiratory motion, align the slice position with the main direction of motion. For example, if you use sagittal or coronal orientations, then you're going to see motion in plane and limited out of plane motion. But for a number of applications that I will show you an example afterwards for cardiac MR thermometry, you may be interested in making any orientation that you want, an arbitrary orientation. And for this, you need to make an active slice tracking. In other words, you need to move the slice dynamically depending on your breathing cycle, for example, to follow the target. Are you going to make a single port eating? So how can we do that? I'm going to show you some slides and present you some results about cardiac thermometry. So how can we do that? You can, for example, synchronize the acquisition using a fast acquisition method I will show you in the next slide. On the ECG that is recorded, you see standard electrodes positioned on the chest of the patient. And for example, to reduce the motion, you can trigger on the signal and then synchronize the acquisition, for example, in the diastole, to avoid motion on your images. Since the period is quite short in time, you need to have very, very fast acquisition. And for this, if you use, for example, the coplanar imaging method, you can acquire several slices during this window of acquisition, and you can monitor temperature change inside the heart in real time. If you want, for example, to compensate for respiratory motion in addition to that and make slice tracking, you can, for example, use this kind of strategy where you position a navigator echo at the interface between the liver and the leg, and you monitor in real time what is the respiratory signal, what is the position of the liver, and adjust in real time the position of the slice according to space and time. Okay. So to acquire this image is very fast. This is the chronogram sequence on the right, which is called echoplanar imaging pulse sequences, where after one excitation you record with this set of gradients the full K space, and then by Fourier transformation back you get magnitude and phase images. So this can be used on any clinical scanner, and you can use this with the standard coils that are used for imaging the chest, for example. With this system we have two coils made of 16 channels, 16 receivers each. Okay, so what can we observe? So using the first strategy, aligning the slice position with the main direction of motion, you can acquire, for example, 4 slices per heartbeat, and you can clearly see that here you have the cardiac muscle in each slice. And then what you can also see is that the cancellation of the blood signal is different in that slice as compared to this one. Okay. And you get the corresponding phase images. And if you use the slice tracking dynamically to adjust the position, you can get this kind of images, and you clearly see that you have a very efficient blood cancellation in these slices, but limited blood cancellation in this slice. Okay, again, you get magnitude and phase images. So we get images, but then how can we retrieve the temperature change from that? We have motion. We have, for example, in-plane motion. So how can we correct for that? Well, if we analyze the magnitude images that we are collecting in time, you can, for example, define one slice as a reference in position, and then any following image that you acquire, can be registered to this reference in position using, for example, optical flow algorithm that analyze the difference in pixel intensity on between two images and compute as a result a motion field vector that gives you an idea or gives you a metric of how much the organ has moved between the two images. And then you can use this motion field to correct for the position in these slides, as you can see on the right, to fit with the original position. So you can use the magnitude images to do that. And since magnitude and phase images are retrieved from the same data set, from the same case space, you can apply this motion field vector to correct also for the phase images. So if you do that, and then from the register position in phase, so you get here my 4 slices in magnitude, everything is registered in position. We apply the same algorithm or the same correction for the phase, and then we compute in each pixel the apparent temperature change in time. And if we look at temperature change in, for example, a single pixel located in the left ventricle, you can clearly see on this graph that it's oscillating with very, very important amplitude. And if you're using this technique without any additional correction, it's not really useful to make a morphometry because then you have an amplitude variation of more than 10 degrees. So there is no really added value for of making a morphometry. So where are these artifacts come from? Well, if you, for example, plot the respiratory signal that you can collect, for example, with a belt position on the abdomen of the patient, you see that it's really highly correlated with these oscillations. And in fact, these oscillations on the temperature that come from an oscillation on the phase images are related to the change in the volume of the lung during the breathing period. If you change the volume, since the blood, since the lung have a different magnetic susceptibility, this will affect or change locally the magnetic field that is seen by every water molecules that are in the myocardium. So as a consequence, since you have a change in this magnetic field, you have a change in the apparent phase, which inherently gives you this huge artifact on the temperature estimate. Okay, so how can we correct that? Well, respiratory motion is quite cyclic. So if you observe during a preparation phase, for example, you can collect a number of images over several cardiac cycles and store this data and use this as an atlas of reference. Then for each new incoming data during the breathing cycle, during the treatment itself, well, you can find in your atlas, for example, if you take this image, you can take the corresponding image in your atlas, then subtract the 2 phase images, okay, to remove the phase artifacts due to breathing, and then you can compute the apparent temperature change between these 2 images. And since from this atlas you can also register the magnitude images on a reference position, you can compute this, you can register this apparent temperature change on the same position, and then using this technique you can retrieve the full temperature change at the same position. So in other words, you need to have not only a fast acquisition method, but you need to have a lot of processing data and to be performed in real time. So first we need to make in-plane motion compensation. Then we have to compensate for the motion-related susceptibility artifacts due to breathing. Then if you have a drift in time of your magnetic field B0, you need to correct it. And then if you correct this, all these steps very efficiently, you're able to compute temperature and thermal dose in real time. So what are the improvements of each step? This is shown on these graphs below. First, if we make only in-plane motion compensation and compute the apparent temperature change in a single pixel. You have, for example, this is a different example as I have shown before, you have very strong oscillations. Then if you correct for susceptibility artifact acceleration using the method I presented below, then you can really have a much more precise temperature estimate. However, you can clearly see that you have a temporal drift of your magnetic field that you can correct. So there are a number of methods for correcting this, either using a kind of sliding window to analyze on what is the change in space and time, or using a region of interest outside the heated region for making corrections. I'm not going to enter too much into the details. And if you want to improve again the temperature estimate, you can also apply a low-pass filter, because temperature change is not going to evolve very fast as compared to the acquisition speed of this technique. Okay. So using this, we were able to go from more than 5 degrees temperature uncertainty to 1 degree simply by image processing. So we can then map for each pixels into the myocardium what is this standard deviation of temperature after all these corrections. And what you can see here on the 4 slices is that you are able to retrieve an excellent temperature precision in the range of 1 degree for most of the pixels located in the myocardium. So this thermometry pipeline can be applied for cardiac MR thermometry, but also can be used to correct for artifacts from any mobile organ, for example, in the heart, liver, or kidney. So can we, after this correction, can we still measure temperature change? So I have no example of HIFU treatment inside the heart. So this is an example that we performed using radiofrequency ablation in a large animal model in a sheep. So a catheter with an electrode is inserted into the myocardium, in contact with the myocardium. And then using this technique, you're able to map the temperature change dynamically during radiofrequency ablation. And you can plot for each pixels in this heated area the temperature evolution in time. Of course, again, as I mentioned before in the clinical experiments or data I showed before, you can also use post-ablation imaging. Here it's a T1 weighted imaging where you can clearly see the lesion you have created. So this is in a 3D, and you can correlate this information with the thermal dose images that you can compute from your temperature maps. And we have shown, you can read the paper that is cited in this slide, that shows that we have an excellent correspondence between the thermal dose and the 3D post-ablation T1 weighted images. In other words, you can rely on the thermal dose images to predict the lesion size. Well, I've shown you that it's possible to make MR thermometry to monitor radiofrequency ablation of the heart. However, this course is about MR-guided HIFU. So can we apply this technique for the treatment of abdominal organs? For example, the liver. So what are the challenges here? First, motion. Motion is a problem for MR thermometry, so I've tried to convince you that we can use rapid acquisitions and image processing method to compensate for that. You need to have strategies for targeting the HIFU, the beam on your mobile target. You also need to deal with the blood flow that is a cooling effect that is going to evacuate the energy you want to bring at the targeted location. And in turn, if you increase the energy that you're sending into your patient, or depositing to your patient, then you increase the risk of having near field or far field heating near the skin or in deep located organs at the interface between, for example, the lung and the liver. The third point is the presence of bones that are going to absorb very efficiently the acoustic waves and convert this into temperature. So we have to deal with these problems. So first, as I said before, I'm going to repeat everything, but we can use exactly the same method, single-shot EPI with parallel imaging. This is an example of an in vivo treatment using a HIFU system with a large animal. This is a pig. So here you have the lung, you have here the liver, and you can clearly see some parts of the heart here. And the advantage of MR is, of course, that you can position slice where you want. And you can also position in different orientations, any orientations that you want. For example, you can put a vertical slice to see what is the spread of temperature along the propagation axis. And you can add, for example, an additional slice close to the skin to monitor the temperature change in the near field to see if you have risk of inducing skin burns. And using these fast imaging methods, you can acquire this volume or these slices in less than half a second, which means that you can update this more than twice a second. So this is an example of a treatment during breathing. So the first images are collected to compensate for the motion. So we clearly see the lever moving up and down. And then using this image processing method I presented below, you can freeze the motion, and then you can start your sonication. And you can clearly see that you have an energy deposition that is located at the targeted region. If you make no correction, you get at the hottest point or at the hottest pixels, you get this temperature time curve where you see clearly strong oscillations before the ablation, and during the ablation you see very, very large oscillations. And you have to keep in mind that the computation of the accumulated thermal draws is not linear with temperature. It's a power of the temperature. Then if you have strong variations, you then make very, very strong mistakes in the computation of your thermal dose images. However, from the same data set, if you use this data to correct for the motion using the strategy I presented before, then you can use this, store these images into the atlas and correct for the curve during the treatment. And you can clearly see that you have a clear improvement of the thermometry results from the same experiment. The second point I mentioned is the presence of perfusion. And in general, what are the influences of the different parameters that are inherent to a given tissue and that will show So the second point I mentioned into MRI HIFU for the organs in the abdomen is the influence of perfusion that is going to evacuate heat that you want to deposit at the targeted region. So if we use, for example, the Pence equation that describes the temperature evolution in time and space, we can, with this model, show that the temperature evolution depends on three parameters: the diffusion, the perfusion, and the absorption. Okay. The term P represents the energy deposition. For example, it can be modeled by a Gaussian function for the HIFU system. Okay, can we have an idea of these parameters? Because if we're able to measure them for a given organ, we should be, in principle, be able to optimize the sonication protocol to achieve the treatment more efficiently. So this are experiments that we did a few years before. You can, for example, take the kidney of a pig and perfuse the artery with isotonic fluid perfusion, and then you position your kidney on top of a HIFU system at the center of the magnet, and you can acquire rapid MR thermometry and multi-slices to cover or to measure the temperature distribution in 3D during the treatment. So if you take, for example, the central slice that is positioned at the focal spot, you have the curve that is displayed on the graph on the bottom right. And so you see during energy deposition, here in red, that you have an important temperature increase, and then after that you have a decrease that is related to diffusion that tends to homogenize the temperature in space, and perfusion that evacuates the energy out of the heated region. Okay, since we have multi-slice images, you can, for example, integrate in space at each time point of the measurement the temperature distribution. If you do that, the diffusion has no effect on the curve that you are obtaining. And then you can show that this curve on the right only depends on the absorption coefficient and the perfusion coefficient. And if you fit this data, you can, to a model that you can derive from the equation I've shown before, you can retrieve the absorption and perfusion parameter. Now, what can we do for the diffusion parameter, diffusivity parameter? We can, for example, analyze the cooling, the thermal spread of the temperature during the cooling phase. For example, at this time T1, you have an important temperature increase, which is quite narrow in space, and as a function of time, is going to cool down and spread due to diffusion. So you can, for example, model this spatial distribution of temperature with a Gaussian function at each time point, and then plot the variance of the results of the fit as a function of time. And you can show that theoretically and experimentally that we have a linear increase with time, which is very commonly known for a diffusion phenomenon. And from the fit, you can derive the third parameter, which is the diffusivity. Now, using this strategy with a non-destructive heating, you could, for example, apply this method to have an estimate of these three parameters at each sonicated point and optimize the treatment accordingly. So from this experiment, I said that we're able to change the perfusion through the quantity of fluid that was going through the renal arteries. So we can, as expected, show that the absorption coefficient does not vary with flow. That's the same for the diffusivity, thermal diffusivity. But as expected, the perfusion coefficient varies linearly with the flow. Okay. The third point I mentioned was the risk of overheating of the bones. So again, MR can be used not only for morphometry, but you can acquire images prior to the treatment, for example, in 3D. And you can clearly see in this example that you have bones that appear in black that are inside the cone beam of the HIFU. Well, using these images, you can segment the bone and then project the shadow of the bone view from the targeted point on the surface of the transducer and select the elements that you can deactivate to avoid sonicating toward the ribs. And then the idea is to use acoustic energy that is sent only in between the ribs. Okay? So you can combine this method with real-time morphometry, for example, two slides. One vertical, where you can clearly see that without or with the activation of the elements, you get similar temperature distribution inside the liver. However, as you can see here, if you now look at what's happening in the near field, you can clearly see that if you don't take care, you have a very strong temperature increase that you can see on this vertical slice. And if you look at the slice orthogonal to this one, which goes through the ribs, you can clearly see the very strong heating and which is focalized around the rib. Now, if you switch off the elements, you still have a heating which is much more moderate, and you can clearly see that you have something which is homogeneous and not really overheating close to the rib. So MR can be used to increase the safety.